Welcome to the Hank Cisco Show. Please don't touch that dial. This is one of my most important shows, and we're talking about our health, how to live longer, how to enjoy life. And back in 2004, right? I'm going 19. 2004, I wrote a letter to the Times Herald when I was diagnosed with prostate cancer. And in that, the opening statement, I said, it seems like everybody's getting cancer. And it really, you talk, so-and-so has cancer, the other, it's really a depressing conversation. And, but they told me I had to go to Philadelphia, get treatment and all, so I said, no, I'm going to stay in Norristown. Norristown at that time, Montgomery Hospital, did not have the sophisticated type of machine that they have in other cities around the country. So I said, but I'm going to take the one here in Norristown. And as a result of that, I was treated by my good friend, she become a great friend, Dr. Grafey. And she is one in charge of the radiation. And I was treated, I'm doing okay, so, and now, since 2004, something new has happened. That's what this show's about. We're talking about advancement. So, Doctor, welcome to the Hank Cisco Show. And now, tell me about the latest machine. What's new at Montgomery Hospital?
Right. Well, we're very fortunate that we had a donation to our department from the Nicholas and Athena Karabatz Foundation.
Can I hold his picture up here?
Surely, yes.
This took place, this picture was taken last week at Montgomery Hospital, right?
Yes. Mm-hmm.
All right. And his name is what?
Nick Karabatz.
Right.
And his lovely wife is Athena.
Right.
And
right, go ahead.
They're a lovely couple who live in Fort Washington, and they're very interested in helping our community.
Right.
And they've given various donations to Montgomery Hospital, first for our MRI machine, and then later for other equipment for the cardiologists. And their most recent contribution has been to the radiation oncology department. They donated a new machine for us.
$2.5 million?
Yes.
$2 million.
Yes.
And I went over and introduced myself to him, and I shook hands with him, and I told him I was the ambassador of Norristown, and and he's a fight fan. We talked about a little bit of De La Hoya and Sugar Ray Leonard, and very down-to-earth guy, really, And I think I have something in common because as a result of this in 2004, this letter motivated donations and all, and they got the IMRT, right? And so he motivated coming up with $2 million, $2.5 million, and now you have this machine. Now
Yes.
we're talking about this machine. Now, tell me about this latest machine
Yes.
that pinpoints where the cancer is. It don't treat where it damages all around the area.
Right.
So tell me about it.
Well, this is a picture.
Right.
This is a picture of our new machine. In fact, this picture was also taken last Wednesday night at our grand opening. And
Marcella Studio was a photographer.
Oh.
Did a nice job.
Oh, they did a great job.
He's the one that took this picture here, too. So,
anyway, the machine is very similar to our older machine in that it's the same brand. It's a Varian linear accelerator, but it has all of the new updated gizmos and attachments to it that allow us to do many new things. For example, we're able to do digital x-rays to verify the patient's treatment positioning, and we're also able to do CAT scans. So prior to each
CAT scan?
Yes. So
all right. Now, I just want to interrupt a second. A lot of people are a little afraid. Sometimes they're afraid they're going to go into a tunnel, and they get close. What they call claustrophobia or so.
Yes.
But this is one with I'll hold this for you while you can explain it.
Yes.
Okay.
Yes.
Now, what's the story?
The machine is open, and the radiation beam comes out of the gantry over here, and the patients are treated with multiple different treatment fields from different approaches. So the machine moves.
Oh, it
and
turns?
It turns, yes. This rotates around the patient. And the great advancement with our machine is rapid arc technology. And rapid arc technology means that we're able to give the IMRT treatments in a single rotation around the patient. And while the gantry is moving around the patient, many multi-leaf collimators are shaping the beam of treatment, and the speed of the gantry can be changed, and the dose rate of the radiation delivery can be increased or decreased depending upon the needs. And the multi-leaf collimators are constantly moving to give very precise radiation treatments just to the desired area and to avoid the areas that you want to avoid.
I guess years ago, that before you had this, the IMRT, there was always a problem with damaging the surrounding areas,
Yes,
I guess, right?
that's correct.
Now, you want to explain a little bit about this?
Yes,
what's this? What am
this picture and this picture are both pictures of a patient's treatment plan when they're getting treatment for a tonsil cancer. So this is a profile or a sagittal view of a patient's face, and it's actually a sagittal CAT scan, so you see their internal structures. And the yellow and red are the high dose areas that you want to treat. And as you move away from it, as you get to the green and the blue, you go into the lower dose delivery areas. Now, in the old days, before the era of IMRT, we used to give what we call a radiation bath, where the whole general area would get 100% treatment.
Wow.
And that resulted in undesired side effects for patients, such as dryness of the mouth because you can't avoid the parotid glands.
I got that.
With the IMRT, we're able to more precisely target the tissues and spare normal tissues. And the difference between these two, this is a conventional IMRT, and on the left is a picture of an IMRT plan with the rapid arc technique, and it shows that you have much better conformity of the dose into the tumor and less dose to the normal tissues.
Oh.
So it's definitely an advance.
Now, Nicholas, I guess, Nicholas, he donated this money, but that wasn't the full. I mean, there was more money needed for that, right? Very
yes,
expensive.
this was a joint venture between the hospital and the donation of his foundation. The donation from the Carabots was for the piece of machinery. However, in addition to that, you have to have a special room called a vault designed to house the radiation unit. So we searched in the hospital and found a small piece of open property near the X-ray department, and we built a new little house to
outside
the
right
hospital.
On Powell Street, right?
Well, it's on the interior, behind the radiology department. So it's between Powell and Forest, Locust, between Powell and Locust.
Locust,
there was
right.
a parking area, and we were able to build this little building that has very thick walls and very thick doors on it, because you need to have a lot of shielding to prevent radiation from escaping from the room.
Yeah.
So building the vault itself was $1 million, and the hospital undertook that on their own. And plus we renovated new areas for our offices, because we had to move from our old cancer center
It was
to
all
this new
crammed in. I
center.
remember we'd go there, everybody was moving here, moving there.
Yes, yes.
But we toured it. At the Montgomery Hospital, we had a lot of physicians and different people were there to welcome him and also welcome the machine. And you spoke. Now, this machine, I know there's not too many hospitals that have that. Do they?
No, that's true. IMRT has become a common type of treatment. However, very few hospitals have the rapid arc capability. And we are the only hospital, the only center in central Montgomery County that has rapid arc technology.
Well, I just hope, there's talking about they're going to build another hospital out in Germantown Pike. And I don't know, I hate to see a hospital move out of town. I remember there was Riverview Hospital, used to be up in Sandy Street, and then there was Sacred Heart Hospital on the Calvin Finance. Now it's Montgomery Hospital, and they're talking about moving out. But, I would like to see maybe that would be the cancer center here, like Fox Chase is famous for, radiation and whatever cancer treatment. So maybe Norristown will be a place where it would be treating,
Right. Well, actually, our cancer center has been in existence for many years, and actually Montgomery Hospital had the first radiation therapy equipment in central Montgomery County. The initial machine that was placed in the hospital was in 1977. And so since 1977, we've been giving radiation therapy at Montgomery Hospital. And as years passed, we increased the number of patients that we've been treating with both radiation and chemotherapy and surgery. So we've had a very active cancer center, at least for the 28 years
Well,
that I've been in Norristown.
Maybe something will be done that they'll stick around, you know. I'm an open type person. I like to tell it as it is and tell, you know, hold nothing back. And I have my heart is right with you on this because I'm diagnosed with colon cancer and I was treated with that with what they call it.
Surgery and
yeah,
chemo?
No,
Did
no,
you have chemotherapy?
Yeah, I got surgery, right? And then treated with the what do they call it?
Chemotherapy?
Yeah, and that, and then later they got prostated, and you treated me on that. Now, just about 3 weeks ago, I could tell you they diagnosed cancer again, but very low, whatever. So the doctor said, well, at your age, 86, you know, it's something you had it 2 times and it's floating around someplace. So I'll let it float around. He says, they're not going to operate or do anything. They'll just
Follow.
play it out, right?
Yes, yes.
So I'll stick around, you know, stick
Yes.
around a little while. But I want to pass on, you know, for people out there, being diagnosed with cancer is not a death penalty or not a, what do they call it?
A death sentence.
Death sentence, not a death sentence, you know. When in doubt, check it out. You know, check and see, you know, get a tune-up, just like a car. It's not running right, go get tuned up a little bit. And that's so important. And now we talked about this machine, okay? And it takes somebody that knows what they're doing to run the machine. Now, tell me about you. Now, you've been around Norristown for how many years?
28.
You've been practicing in Norristown.
In Norristown for 28 years.
The only place practically you practice,
Yes,
right?
yes.
You come out of what college?
I came out of Villanova University, and I went to the Medical College of Pennsylvania, and I did my residency at Hahnemann. And
Right.
when I completed my residency, I came to Norristown, and I've been here ever since.
Ever since. Now,
Yes.
that's what you call loyalty, right?
Yes.
You know, and just today's paper, I read where Judge Sirica, who was born and raised in Norristown, now was just received an award of being a good federal judge by one of the Judge Roberts of the Supreme Court. And last week I had Monsignor from St. Paul's Church, you know. He's, 89 years old, born and raised in Norristown. You know, here's people that dedicated their whole life here in Norristown, and we're the county seat. And I think we start pounding our chest at, you know, what we have here. And people like you that dedicated your life helping people. And how many people have you treated that, you know, are still around and they're not around?
Yes, I've seen over 1,000 cancer patients in my career, and many of them I still see in follow-up.
Right.
Yes, and really, like you said, cancer is not a death sentence. There are so many types of cancer that are easily treated. The patients are diagnosed at earlier stage of breast cancer and prostate cancer, even colon cancer and lung cancer.
Right.
And so the patients are much more treatable, and the tools of the trade are improved, not only the radiation,
Right.
but also chemotherapy and other types of immunological treatments that are now available that weren't available previously. You may have heard of the drug called Avastin, Erbitux, Tarceva, Herceptin. These are all treatments that are not actually chemotherapy, but they're biologic
Right.
treatments that work for many different types of cancer. So we've seen a lot of advances, and I think it's been a privilege for me to be in one location over so many years. I mean, there are some families where I've treated 2 or even 3 generations, actually, of patients that I've treated, and I feel like my practice is family practice for cancer patients.
Right.
And I like to reassure the patients that cancer is not a death sentence,
Right.
and it's sort of turning into a chronic disease like high blood pressure or diabetes, where you just have to manage the disease.
right.
So many
Management.
times patients are cured, but in the cases where they're not cured, they certainly can be managed for many years and live a good
Well,
quality of life.
That for men, I know a lot of men, it's embarrassing because they have to go get checked out, you know, like the, you know, whatever that. And some of them, but let me tell you, now they have it now with blood, right? You can check with
For prostate cancer, a blood test can be a tip-off if there is
give you
prostate
give
cancer.
you an idea.
Yes.
That's what mine
Yes.
was at 2 point, something like that,
Mm-hmm.
something like that. But when I diagnosed when I had to get the radiation and everything was 7. So that's pretty high, you know. So as long as I have it, you know, I'll bob and weave with it.
Right, right. Many times when patients are diagnosed, the PSA can be from 5 to 50. I mean, if it's 50, that's pretty high, and there's a high chance that the person could have distance spread. But usually when it's diagnosed in the range of, you know, from 5 to 15, the disease is localized and quite amenable to treatment. And then even if the tumor reactivates, there's still additional treatment that can be given if necessary.
Doctor, let me ask you, is there any truth, not truth, whatever, studies or whatever, that there's certain areas of Pennsylvania or United States where there's a lot of cancer patients? I saw something in the paper, something about in the area of Pennsylvania, southeastern part of Pennsylvania, there's a lot of cases because my open statement there, it seems like everybody's getting cancer somehow or other. I know the golf players that are out there playing golf, they get cancer of the skin.
Yes,
right?
yes. Now, skin cancer is definitely something that is a result of exposure to too much bright sun. And most of the time, skin cancers can easily be treated, but it's always smart to wear a hat when you're outside playing golf and to wear a lot of sunscreen. That's one of the sort of preventable cancers, but also a very treatable cancer. There is a high incidence of breast cancer in southeastern Pennsylvania. We don't really know the reason for it.
In Pennsylvania, it's high.
Yes,
okay, then
yes.
yes,
there is.
I'm right on that.
There is. But still the...
I'm not panic. I don't want anybody to move out of Pennsylvania.
Right. But the stage is not more advanced than in other areas, and patients are very well treated. Yeah, I'd like to say another thing about our new department and our new equipment, and that is that we have integration between the treatment and the treatment planning system and the electronic medical record, which is new to our department. So we're actually going to be going entirely digital over the next few weeks.
What do you mean?
Digital, it means no more paper charts. Many of our patients have charts that are like 3 inches thick that contain all of the correspondences and x-ray reports and the treatment plan. Well, now all of that can be put into the computer, and instead of having a chart that 6 different people are looking for, it's all on the computer, and you just go to the computer and you can find it.
You know, you just hit me on, I don't know, sometimes I go to my doctor, Dr. Melnick, and I had other doctors, you know, but I see some patients when they have to get the folder, you know. You know, it's folder, sometimes the guy's going to get a hernia and lift that thing up.
That's the truth. That's the truth, yes.
But now everything will be digital, right?
Yes, right. So anytime we get an x-ray report, we scan it into our computerized chart, and the dictations are all through the computer, and we can fax them electronically to the referring doctors.
And x-ray too, x-ray?
X-rays are digital,
I know with Dr. Paleo, when I had the hip, I had to get the hip replacement first one was 8 years ago, and then the other one was last year. There was a big difference between the two. But I had to get x-rays from Montgomery Hospital, and in his office he says, oh, I got them here. Yeah, boop, push the button, here it is.
Right, yes.
From the Montgomery Hospital to his office, just like that. He got the, you know.
Yes, it's all like web-based technology where the images are able to be downloaded onto a doctor's computer. I have that in my office as well. Right. So we can review all of the x-rays and CAT scans before the patients come in to be seen, and no x-rays. And actually that's a gigantic savings for the hospitals because film is a very expensive item. And so not only do you eliminate the film, but you eliminate the storage. And again, it's a question of looking for x-rays. That's always a problem, trying to find them. And now they're just all reside in cyberspace. It's wonderful.
But you know, this gentleman and his wife, you know, they wanted to build a hospital in Norristown, and I don't know, it was something messed up. I don't know, it was a little bit of a misunderstanding or whatever it was, and he didn't follow through on it. But we lost out on that.
Yes, he wanted to make a $15 million donation.
$50 million.
$15 million to Children's Hospital to build a clinic in Norristown.
Main and Barbados Street, right.
Yes, and it's unfortunate that the politics got in the way, and there was some, you know, questioning of where you should put the clinic, and how you should put the clinic and who should put the clinic
Yeah,
and what
yeah.
should Children's Hospital do for the kids in Norristown.
So he
And to
just
make a long story short,
he bailed out.
he bailed out, and they're
Right.
building the clinic in
Well-
West Philadelphia.
Well, who's in charge of the hospital? He's the superintendent, or what do you call it? The man he gave a speech about him.
Tim.
Yeah, what's his
Tim
name?
Casey.
Yeah,
Tim
okay. He gave
Casey's-
a talk about him being Greek.
Yes.
And, talking about the Greek, the history behind the Greek, the theater and all. Maybe Norristown's talking about getting a theater. Maybe we'll get him interested not only in the hospital and theater too. But he's a great guy on talking about boxing and also really down to earth. They think I was shaking hands with, shake the hands of a millionaire. So
Well,
it's a great guy. But you never realize that the guy, and he wants it for the poor.
Right.
That's for the poor. He earmarks it for the poor.
Yes. Well, he's a self-made man. He's originally from the south of Bronx, and he brought
Where was he from?
Bronx, the Bronx in New York.
Yeah, I was born in Brooklyn.
Oh, okay.
So we got
And
something in
anyway,
common.
somehow along the way, although he didn't go to college, but he had a very good business sense, and he developed a business for magazines, and he's a giant publisher of puzzle magazines. And from there, he went on into other fields with publishing other types of magazines and real estate holdings. And I think he owns a golf course, and he's a very successful man. And now, in his later years, he would like to give back to the community,
Right.
and he has a really soft spot in his heart for inner city, like inner city Philadelphia, inner city Norristown, and it's a wonderful thing that we have him in our community.
Well, Norristown is like it's on its backside right now. It's on the ropes like in boxing. So it takes a man like him and to motivate other people. I mean, he just can't do it all himself. But I'm telling you, I would say that like at a theater in Norristown, we'll bring restaurants, it'll motivate this town in the
Yes.
county seat. So
I
who
still think
knows?
we need a college.
What's that? A college.
We need a
Right,
college.
okay.
I just heard that Rowan University bought a big old building in Camden, because Camden is another city that's down on its
Camden,
luck,
yeah.
and they're trying to bring in more students.
Well, if the hospital moves out, they could move a college in there.
I think that would be wonderful.
That'd be great.
If there was a branch of the Montgomery County Community College or Sinus or Villanova or
Right.
Temple, it would be wonderful.
Yeah, well,
It would be good for the community.
I was just inducted Hall of Fame at Montgomery County Community College at the police science course. You're right. Theater, education, and Norristown. Now we have the county commissioners are saying, well, we want to help Norristown, motivate it and move it, but it's men like him that will motivate. Just for him to just give money, but I think he will motivate. The more we talk about what he's doing. Another man is Pat Mascara, who's helps out. He donated $1 million for add a wing to the vegetation school. And people like that he's poor. He said he never, he used to get people would give him money for lunch, but he didn't know who gave it, and he's
Giving
helping
back
out.
to the community. That's a wonderful thing.
But now tell me something about your family.
My family, well,
I know your husband, right?
yes, my husband Peter, we've been married for 32 years, and we have 3 sons. Our oldest is 28.
I met them all, right?
Our middle son's 24, and our youngest is 16.
Are they going to
very
take up?
in medicine?
Right?
No.
No.
Business. They're all in the business
Well,
field.
that's okay. That's okay. Now, Casey gave a talk about. He's the what do you call
Yes, Tim Casey is the president and the chief executive officer of Montgomery Hospital. Yes.
it? And there was quite a few physicians there. And then now one other thing, we on May the 15th, we're going to have our annual walk
The
through
walk
the
in the
park.
park,
Okay.
yes.
With Stan Husky and I helped out with Montgomery. They called us and asked us to help out. And it started how many years? It's going
It's about 7 or 8 years now.
8 years now. And each year it's getting bigger and bigger. And that money is going to help.
For the programs of the Cancer Center,
Right,
yes.
right. And we meet out at Norristown High School. There's a walk through the park. There's food. ShopRite donates food and different people
Yes,
donate.
it's a very lovely event. It's
Right.
a community event. Lots of people come and bring their dogs, their pets. They bring babies and strollers. Older people, middle-aged people, and young
Right.
people alike all enjoy the walk in the park. It's a short walk.
Yeah.
It's not too taxing. It's like
Right,
2 or
right.
3 miles, And there are snacks in the pavilion after the walk, and it's really a fun event.
Yeah, and Stan Husky will be putting in the paper about the event. It's on the 15th of May, so we want to, keep your eyes open on the newspaper, and we're going. So, I just want to close this that time. How do you keep yourself? You get to know the people and treat them, and then suddenly, there's nothing else you can do, and they pass away. How can you? How do you?
How do I cope with that?
Yeah, that's the
Yeah.
word. How do you cope with that?
Well, sometimes it can be hard because sometimes the patients we've known for years, 12, 15 years. In fact, I just lost a patient recently. But we know that we did the best that we could for them, and we got them through many years. And it's sad, but if you know that you did the best that you can, and that's all that you can do.
I know you have pictures of different people in the office
Yes.
at different times. But, okay, our half hour is over. But, ladies and gentlemen, I want to thank, I'm going to call him Nick.
Nick and Athena.
The great guy and his wife, and Athena?
Nick and Athena Karabatz.
Right,
Yes.
okay.
It's the
So,
Karabatz Foundation.
I want to thank you very much.
My pleasure.
All right.
It's
all
always
right.
a pleasure.
Ladies and gentlemen, thank you for allowing us to come into your home. And look, check it out now. Without doubt of anything, check it out and have no fear. Okay? Thank you very much. And until we meet again, let's have a little toast here. All right? And we say in Italian, alla salute, to your health.
Salud.
There we go.